3 years ago, the Wamsher family's life changed in an instant when 8-year-old Cameron was hit by a car while walking on the road near his house with his siblings. They were not sure he would be able to survive, but thanks to the trauma team, including multiple surgeons, doctors, nurses, therapists, and everyone at Penn State Health Children's Hospital, Cameron is here and thriving. So joining me, we have Cameron, also Nicole and Kyle Wamsher. They're going to share their story with us. What a story this is. What do you remember about that day, Cameron?
I don't remember much. I just remember the morning. It was Valentine's Day, and I was so excited to take my Valentine's into school. And then that's just the last thing I remember.
That's it. And
Yeah.
then you just woke up in a hospital.
Yeah.
Oh my goodness gracious. What do you remember about that day? I mean, take me back to when you learned what happened.
Well, I was at work, and his sister kept calling my phone, and I thought it was just kids being kids, so kept declining the call. And then I read the text that Cameron had been hit by a car. And it's just, your body just goes into survival mode.
Yeah.
You know, you just want to get to him. I wanted to get to him and make sure he was okay. I was talking on the phone. I don't remember who I spoke to, but I'm just screaming, tell me he's okay.
Oh my gosh.
And no one could, so you just go right to praying.
And the thing is, there wasn't that much hope at first, right? I mean, Kyle, tell me kind of what happened, because doctor said he really beat the odds here. What were some of the toughest, times you went through?
First 40 hours were really hard. The team of surgeons and doctors, they took care of him initially with the surgery. They actually left his incision open, which helped his head wound heal.
Oh.
But the first 48 hours, not being able to take care of my son, just having to sit there. The nurse that we had was amazing. Matt, he did it for me. Yeah, he took care of Cameron amazingly. So.
How did you, though, just have the emotional strength to do this? Because Mom's crying 3 years later, just can't even get one sentence out about this because it's awful.
I would put that in our faith in God. He had a bigger plan for Cameron than just at 9 years old.
No kidding. So Cameron, do you remember your care? Do you remember Matt? And do you remember the care that you received?
The nurses, they would bring me ice cream, and they brought a dog, and they helped me and my parents a lot.
We've had some of his dogs before here on the show. Yeah. They work wonders for patients. It's just absolutely terrific. And it's just so inspiring, the story. It's incredible. What would you say to other families who hopefully won't, but could be facing a trauma like this?
I would say just take one day at a time. It's okay to feel overwhelmed and scared. Really rely on your network of people, your family, your friends, and the professionals. As parents, we prioritize our children's health and recovery, but it's very important to take care of yourself. So make sure you're taking care of yourself so you can be there for your children or your child. And also just remember that every day is progress. Whether it feels small, it's progress.
How long was Cameron then in the hospital?
21 days.
That seems amazing, though.
Yeah.
That seems
Absolutely.
I thought you were to say 3 months,
Well, when we first went in, they told us you can expect him to be in a coma for weeks. And within days, he was breathing over the breathing machine. He took control, and God took control, and with the help of Penn State Health and God, it was miraculous.
Yeah, that seems like a real team effort there between
Yes.
God and it's to have that faith in God, but also the faith that you had in the medical professionals,
Right.
and the trust had to be comforting, to
Yes.
really trust where you were at that moment.
Yes.
Oh my gosh. Okay, I did get a little bit teary. It's a miracle.
Yes.
It's a miracle, and it goes to show the expertise at Penn State. So thank you for sharing your
Yes.
story.
Thank you
it's
for
just
having us.
great. And we're going to hear from Penn State Children's Hospital's Division Chief of Pediatric Surgery. That's in just a few moments. But first, as part of this special Good Day PA, ABC27 and Penn State Health Children's Hospital are hosting a web chat. To ask a question, go to abc27.com/surgery chat. Janelle Knight joins us with some viewer questions. Hey, Janelle.
Hey, Amy. Jen Lau, Program Manager of Pediatric Trauma and Injury Prevention with Penn State Health's Children's Hospital, is here with us to answer some questions. We do have one here for you. So it's getting warmer. People want to know, how can parents tell if playground equipment is safe and age appropriate for their child?
It's a good question because not all playgrounds are made for all ages and stages. So some playgrounds are marked with signage that indicates an age range, but ultimately parents should be aware of your child's developmental abilities and make sure that playground is geared up for you. Some things to be on the alert for: is the playground well maintained? So is there rust and sharp edges where there shouldn't be? Are there glass bits and debris littered throughout? Is it clean? And certainly looking at the surface of the playground. Avoid concrete, avoid grass. Sometimes we think grass is soft, but it's not meant to absorb shock. So you want to have a shock absorbent surface. If it's mulch or sand, it should be at least 12 inches, but ideally it's a rubber shock absorbing bottom.
Okay, so warm weather, playground equipment,
Yep.
but also riding bikes and things. When should kids start wearing helmets on bikes, and what other safety gear is essential for preventing injuries?
Well, first of all, anytime you're riding a bike, you should
Yes.
always wear a helmet. And one of the most important things too is parents as well. Parents should role model wearing helmets. So everybody on a bicycle is wearing a helmet. And certainly if you're on a hoverboard or a skateboard or a scooter, we want to also add those wrist guards, those knee guards, those elbow guards, and other things to make sure that we stay safe and avoid those broken bones.
All right, thanks so much, Jen. We'll check in a little later in the show with you. Back to you, Amy.
Thanks, Janelle. Well, a few moments ago, I spoke with the Wamsher family. Joining me now is Dr. Rob Ricca. He's the Division Chief of Pediatric Surgery. I don't know why I have trouble with that, at Penn State Health Children's Hospital. Dr. Ricca, how critical is it to have an academic medical center and a level 1 trauma center nearby when seconds count, like in Cameron's story?
No, I think it's vitally important for us to be very involved in trauma care within the central Pennsylvania region, and that's one of the reasons I recently moved up here. I think it's an outstanding opportunity to be here and be part of such a great team. And when you look at trauma, it's part of a system, and we as a level 1 trauma center have a responsibility not just to the local patients, but to the region as a whole to improve the trauma capabilities. So we partner with schools, we partner with local EMS, we partner with our local government, we do advocacy, and that is all part of the role of the level 1 to really improve the care of every child within the central Pennsylvania region, whether they walk in the doors of Penn State or not. We are there to impact them and make their care better.
We've all seen the medical traumas of the intensity of an ER. Is it like that? Like, what happens when you hear a severely injured child is coming in? Like, how do you get into action?
So yeah, I remember the show ER a long time ago. I don't know if that was ABC, but it was a great show. It was a good show. I don't know if I can say that. Maybe I can't say that on TV, but nonetheless. But no, it is. It's a couple seconds of excitement as you're sitting there. We get a notification to know that a child or an injured patient is coming in. They let us know. We get some pre-notification information about what the injury is, so we are prepared. We have the our team sitting there waiting, ready to go at a second's notice. And as a level 1 trauma center, 24/7, 365, we're able to care for any of those patients that come in.
Cameron's survival story is almost unreal. It's pretty much miraculous. But what do you have to say about the pediatric surgery team at Penn State Health Children, and really what makes this team so special?
Sure. No, and I think, as you pointed out, 21 days is tremendous. It seems like such a short time. And I think the key word is their team. And it's not just, when we think of the team, we think of pediatric surgery, pediatric surgeons. My team extends well beyond that, as I'm looking at my nurses, as I'm looking at the emergency room physicians that help care for the patients, the critical care physicians that help care for the patients, the operating room staff, everybody that springs into action ready to go at a moment's notice with the top level of education and at the top of their game and expertise. And so we could not do this without a team. And that really is what trauma is, as we say it for trauma surgeons. It's a team sport, and we really push to improve the care and to improve the knowledge of everybody on that team.
Yeah, you're all just ready to go, and the collaboration is incredible. Thank you so much for talking with us.
My
it was
pleasure.
really great
It's
to get to know you today. Thank you, Dr. Ricca. For more information, or if you would like to make an appointment, call 717-910-1638 or visit pennstatehealth.org/children's. Well, coming up next, we'll hear from a dad who had to trust the team at Penn State Health Children's Hospital to take care of his newborn baby who needed jaw surgery. You're watching Good Day PA on abc27. In In the United States, between 10 to 15% of all babies born require care in a neonatal intensive care unit. That was the case for a central Pennsylvania family. Deborah Pinkerton spoke with Scott Douglas about their story.
Scott, thanks so much for talking with us. Can you take us back to the moment when you first realized that Lucy would need surgery, she would need to go to the NICU? What were those early days like for you and your family?
We kind of found out right after she was born that she was struggling to breathe pretty significantly. The nurses were trying to do what they could to get her oxygen levels up. She came out a little blue, and it all went very quickly. Ultimately, they called in the NICU nurses, whisked her right up to the floor above the NICU, and it took us by total surprise. We had no idea kind of leading up that anything was wrong, and it was quite a mix of emotions, right? You start with, elation from having a brand new little one. This was our first kiddo, to then the shock and worry of having a kid that wasn't healthy and might have some major issues. And so that was obviously very, very stressful and a really significant mix of emotions.
Yeah, as a parent, I can't imagine going through something like that. So the doctors told you that she would need surgery because her jaw was too small. So what did this diagnosis mean?
So we kind of knew shortly after going up to the NICU that they had figured out what was wrong. So she had a very small jaw, as well as a cleft palate, something they call Pierrot band sequence. Finding out that she needed surgery was obviously very, very scary, but also a little relieving because we knew that we had to fix the problem and we knew that there was an option to do so.
How was it watching your daughter go into surgery? And how did the whole team there at Penn State Health Children's Hospital really wrap their arms around you and let you know that it's going to be okay?
It was actually interesting. I did my medical school at Penn State, and I did rotations with our surgeon, Dr. Henry, and I knew the anesthesiologist. He was a class below me in medical school, and so I felt very comforted because I knew they did a wonderful job. I knew they were in good hands, but obviously it's still very scary, right? And knowing the post-op recovery, which you would have to go through even, a week after the surgery, was obviously very scary, but I knew I was in good hands from the physicians we were working with, as well as the nursing staff was very comforting.
So how did the surgery go, and what was the outcome like?
So she had something called a mandibular distraction. So basically they cut her jaw on both sides, put in some metal hardware, and then over the course of a week, expanded her jaw bit by bit. And so through that entire time, she had a breathing tube down because of the risk of breathing with doing those expansions. And so that was definitely the hardest time that my wife and I had to go through, is watching her with a breathing tube. And, one thing I will never, ever forget is watching a baby try to cry and nothing coming out. Right? They can't make any sounds. And that was just the hardest, most gut-wrenching part of it. But eventually we got through it. She got the breathing tube taken out and she did great. She could breathe on her own. It was wonderful. But it was hard to go through for sure.
Now that you're on the other side of this journey, what advice or words of encouragement can you give to our viewers who may be going through something similar to this?
Don't do it alone. We were very fortunate that, we made some friends in the NICU. We called them our Bay Buddies. And it's really hard for somebody who hasn't done it before or isn't doing it to understand what you're going through as parents. And so when you make those connections with people who are doing it and going through it with you, that made all the difference.
Thank you, Scott, for being with us, and so glad that Lucy is doing so well.
We are too. Thank you.
And thank you so much to Deborah. For more information, or if you would like to make an appointment, call 717-910-1638 or visit pennstatehealth.org/children's. We'll be right back. Welcome back. Joining us now is Dr. Cathy Henry, pediatric plastic surgeon with Penn State Health. Lucy had such an interesting case. When did you first meet her, and how did the medical team make sure she could breathe okay?
We had the benefit of meeting her really shortly after delivery. When the small jaw and concern for airway obstruction was recognized, our team knows that those babies do best if they are positioned either on their side or on their belly, and that helps relieve the obstruction and stabilizes them, at least temporarily, very quickly. She also benefited from what's called a nasopharyngeal airway, which is a tube that can be placed through the nose. It goes past the back of the tongue so that babies are able to breathe. And then she was able to be stabilized in the NICU, where all of the various specialists that needed to see her could be assembled and do their evaluations.
What a delicate case, though. I mean, dealing with that and just a little tiny baby, it's very complex. Can you walk us through the procedure, how you went through all this and cared for Lucy?
Well, we are very lucky to have the appropriate team in place to do this safely for babies. So we have pediatric anesthesiologists. They, along with the ENT doctors, make sure that we have a stable airway for the patient that allows us to do these surgeries. And then small incisions are made underneath the back of the jaw that allows us to get to the bone itself, where we make a small cut in the bone called an osteotomy. And then the device that does the distraction is placed on either side of that cut in the bone. And then after surgery, over the next several days, we activate the device. It pushes the cut ends apart and new bone grows in the middle. And as the bone comes forward, it pulls the tongue and the soft tissue with it and relieves that obstruction.
You mentioned so many times in your answer, team and we. And so the team is so important. You have the NICU specialists, surgeons, respiratory therapists, others, not only having them in place, but them being able to work so well together and to collaborate so well together. How are you able to do that to provide just the best care for these children?
Well, I do think we are lucky to have just a very, experts in the field, wonderful group of people, but also great colleagues and are very dedicated to the care of these patients. It was recognized that this patient population, they have a specific number of things that need to happen fairly quickly from various specialties. So we formed a team, and we meet every time one of these kids comes through the NICU. We meet as a team, have regular discussions, reviewing the findings from the latest studies, and then come up with a coordinated plan and then communicate it effectively to the families.
And just what kind of support is available to those families?
There's support systems in the hospital and then also after they leave. What will typically happen is, baby works on feeding and growing, goes home from the hospital, and then they continue to be followed by the various specialists that they need. And then long term, a majority of these kids do also have a cleft palate. They will follow up at our Lancaster Cleft Palate Clinic, where we have social work support in addition to all of the medical support that they will need.
Yes, that is a very special place in Lancaster. Thank you so much for being with us today. It was really nice to talk with you.
Thank you.
For more information, or if you would like to make an appointment, call 717-910-1638 or visit pennstatehealth.org/children's. We'll be right back. Welcome back. As part of the special Good Day PA, abc27 and Penn State Health Children's Hospital are hosting a live web chat. Janelle joins us again with more.
All right, thanks, Amy. Jen Lau, Program Manager, Pediatric Trauma and Injury Prevention with Penn State Health Children's Hospital, is back with us to answer more viewer questions. All right, this topic from the viewer, it's very tricky, car seats. I remember bringing home my son for the first time, putting him in the car seat. I was so nervous. So how do you make sure that the car seat that you're getting for your child is the right one, and most importantly, it's installed correctly?
Good question. There are so many different seats. They're all different. A good place to start is first reading the manufacturer guidelines for your seat for maximum height and weight. A lot of times families and children are anxious to move up to the next seat. So for instance, from a 5-point harness to a booster, best practice is truly to keep them in that original safer seat until they've exceeded the height and weight for that seat. In terms of installation, definitely recommend installation check by a certified child passenger safety technician. We're fortunate at Penn State Health to have an excellent team of child passenger safety technicians. We have lots of events in the community. Our website is pennstatehealth.org/pediatric injury prevention. We'd be glad to check your car seat anytime.
Okay, all right, let's move on to the next viewer question. All right, toys. What are some toys that can be dangerous, and are there toys we should avoid for our kids?
Yeah, first I would say water beads. So they look like sprinkles. They really look like this delicious ice cream sprinkle, but when you put them in water, they expand. It's really dangerous when children put them in their mouth and swallow them, because then they expand and that could require surgery to remove them. Other things we look at are those high-powered magnets. If young children ingest those, then they stick together, also potentially needing surgery. Button batteries are always dangerous, and we are very alert for choking hazards. Something just to be cognizant of: if you have an older child who's 8, it's maybe really appropriate for them to have toys with small parts, but if they have a younger sibling who's 1 or 2, we've got to make sure that those small parts are kept away from younger kids.
All right, thanks so much, Jen. You'll be here answering questions until 11 o'clock, so keep the questions coming in. You're getting quite a bit. Stay with us. We'll be right back.
Welcome back. We thank the team at Penn State Health Children's Hospital for today's special program, and of course the families for sharing their stories with us. For more information, or if you would like to make an appointment, call 717-910-1638 or visit pennstatehealth.org/children's.